Hello, everyone. This is Dr. Melanie Gray with another episode of Code Calm, the podcast that helps formal and informal leaders, people just navigating life, learn to manage stress and live well. It is my great pleasure today to have Dr. Maiysha Clairborne, MD, integrative physician, leader, advisor, and founder of the Mind Remapping Company. She has over 20 years of experience in medicine, coaching, and neuroscience-informed leadership. She helps organizations and leaders improve communication, build trust, and create psychologically safe workplaces. Dr. Clairborne, thank you so much for being with me today. Tell us, what are you seeing in the workplace that is creating these psychologically unsafe workplaces that you need to help adjust?
First of all, thank you so much, Dr. Gray, for having me on. It is such a gift to be able to share with your audience. Oh my goodness, what am I seeing? So much. I think the biggest thing that I'm seeing right now is the conflict. I mean, there's so much tension in the atmosphere, in the world, in the nation. We all know what that is. And what's happening is people are hypervigilant. People don't know who they can trust. And suddenly that gets brought into our boardrooms, our executive teams, our leadership teams, our patient rooms, our ER floors through communication. And that communication creates tension and conflict. And so when we are interacting with each other from our hypervigilance, from our distrust, then that just propagates unsafe spaces.
So in my experience, working with healthcare providers, I have found very few that would openly admit that they have an issue with trust, because we're caregivers and we're engaging and we're trained to collaborate. How can you help people see this blind spot of distrust that they could be carrying into conversations and committees and in their work? Mm-hmm. That's not translating well.
I think it starts with stating the common struggle. And when we start to state the common struggle, and that may be different things for different organizations, we get everyone in agreement. And so when we start with stating the common struggle or the common value, like what we all want is, and what's not happening is, then people start to open up. Also, I think it makes it helpful if there's just one person who's willing to model that vulnerability. And I think we're starting to see that. So now we have conditions where psychological safety is becoming the word of the day, and intertwined inside of safety is trust. And so we now have organizations who are committed to that and are opening the doors a little bit for people to say, I don't feel safe. And when we begin to connect safety and trust, it opens the doors for that conversation of where the trust is lacking specifically, so that we can open the conversation for the pathway moving towards how do we then fix it.
Well, have you seen that some of the individuals that you coach are having issues with trust because they haven't managed the trauma of their past? They haven't really dealt with themselves properly?
Yeah, that's part of it. There's a real issue in organizations with transparency. When organizations reorg and then they don't communicate, they don't acknowledge that there's reorganization happening, and that they don't acknowledge how this could impact the feelings and the anxieties that come with organizational reorgs. I think that is a real thing that causes broken trust, is that lack of communication from leadership. But certainly what it does is it hits the person who may not have dealt with some of their own wounds of the past. It hits them in a particular way that provides even more hypervigilance. So when you have someone who hasn't necessarily dealt with that, and that button is pushed and they don't know exactly how to deal with it, then it comes out in their communication and their behavior.
We kind of took this road on hypervigilance. For listeners who may not understand what that looks like,
yes,
could you describe what hypervigilance can look like?
Absolutely. I often liken it to constantly looking over your shoulder. waiting for the other shoe to drop. It may feel like in your body a tension in the shoulders, a constant tension in the shoulders, a constant holding of the breath. Like you might find yourself holding your breath, or a constant sort of like tension in all the muscles. But mentally, it's like the mind is always looking at it's on alert. When's the next shoe going to drop? When's the next hit going to come? Looking over the shoulder. That is the state of hypervigilance. It can also cause extreme fatigue. So you can have like the hyper end and you get like the hypo end where you're in avoidance, right? So you're maybe trying not to, you're like just really numbing out. Like that's another way. Avoiding conflict, avoiding interaction altogether. In its extreme isolation.
Well, as a physician, our physicians, our nurses, our healthcare leaders, physical therapy, no matter what discipline you're in, they have to meet a lot of quotas, let's see. They have to meet their numbers, which can be stressful. And they have to meet the numbers with sick people who take more time, I believe, than the system is really built to give them. And I that becomes hard. I always say people take more time than we really think and more time than we really want to give. Yet, we need to do this and still meet our numbers so that we keep our jobs. How do you help healthcare leaders navigate the numbers of their accountability toward the numbers, yet maintaining some peace within themselves?
This is a challenge one because it takes a village or it takes a community in order for this to happen. When I work with clinicians who are on those front lines seeing patients, one of the things that I help them do is to become more efficient and to utilize all the potential resources so that they can be present. So as an example, I have a clinician who's seeing patients and the charting in inbox is always an issue. Right. So, but they also are committed to like being present with the patient and connecting with that patient. So we talk about, well, what are the resources you have? Do you have scribes? Do you have the AI translator? How do you communicate with the patient in the moment? Like, okay, I'm going to write this down here so that I make sure I get everything that I need so you can finish your note, most of your note, even in the room and not feel like you're staying 3 hours after the clinic is done to finish your note. So that's a lot of what I help my clinicians do who are from a charting standpoint, who feel like they're drowning. From a leader standpoint, it really is helping them to understand that connection. Like if we have our clinical leaders, but we also have a lot of leaders who are separated from clinical, who are not clinical. They might not understand what we go through. So like helping them to listen to and get the world of how this is impacting their clinicians when they're not given the space to have protected time for admin or given a little bit longer appointments or have maybe blank spaces on their schedule so that they can catch up.
Are these tools, are these resources, assets that are really taught in medical school?
And not at all.
Not at all. So and not in my time either. And I kind of think that those of us in healthcare are kind of taught that we have to have this big S on our chest and we have to do it all, that we must be invincible, and that to ask for help is a sign of weakness. And what I'm hearing you say is asking for help can be a code for calm so that people can navigate their work more efficiently with less stress. How do we help people understand that we're not invincible?
Well, one of the things that I do when I teach leaders, I do leadership workshops and conferences, is to talk about emotions as data, right?
I love that.
Yes, because a lot of what happens is we're taught, I teach about emotions being data, but I also teach about our conditioning, the conditioning that we've grown up in childhood, but the conditioning that our industry brings around exactly what you just said. Showing emotions are weak, asking for help is weak, and start to dismantle some of these old conversations so that we could begin to open up more vulnerable conversations about what we need. And even leaders, I think leaders have these very similar conversations about trust, about safety, about disclosing their own vulnerability, and that being weakness. And then when you have a leadership team that's not trusting each other, that's not trusting their staff to be able to be vulnerable enough and understand that that is a model for what they can do to create safety in the organization, then we just have the trickle down effect. So a lot of what I do is help to dismantle the old conversations that have given us the culture that we now have in healthcare.
Well, I appreciate that, because there is a lot of conditioning and there is a lot of fear. You opened up our conversation, I believe, mentioning how there are so many mergers and the unknown is happening also all the time. I use my community for an example. When I began my career, there were probably 12 to 15 community hospitals in our metropolitan area. And now there are only 4 systems. Large systems, maybe 5 in my greater metropolitan area to work for. And I don't think this is going to slow down. I don't know about you.
Yeah, I agree. I agree. It's not slowing down. I'm seeing the exact same thing. I mean, I'm in Atlanta, and where there used to be multiple 6, 7, 8, 10 hospitals, they have definitely merged into, maybe 3 or 4 major systems, and even some systems that are coming from different parts of this, other states are beginning to then, move in and acquire certain aspects or certain systems as well. So we are definitely, it's like, the Starbucks phenomenon, right? Like they have the monopoly. We're seeing that in healthcare as well.
We are, and I do think that it breeds some level of uncertainty when in the work and that we do, and it takes the focus off of the patient. We don't always see ourselves because it puts us in survival mode. Will I make the cut or will I not?
That's
make
right.
the cut. I don't know what your guidance is. I'll tell you what my guidance has been.
Yeah.
For stress related to this uncertainty is just save your money, because at a certain and live under your means, because there is an unpredictability, and so it's like the old TV show, one day you're in and one day you're out. You cannot always control it. Right?
Yeah.
You can do your best, but the human nature is such that people bring with them those who they know, like, and trust. If they get to go along themselves, move forward themselves. And if not, and everyone doesn't make it, right? And there are only so many chiefs, and the number of presidents decreases. People need to have a plan B, I believe, Dr. Clairborne, that will help reduce their stress, to live below their means, to save their money, because the unexpected is going to happen.
Yeah.
And how will you pivot?
How will you pivot? I agree with that. I think that having multiple streams of revenue, saving, being financially responsible, good stewards of our money. But also I think community, having the right community is also a way to navigate and manage your stress. One of the things that I feel fortunate to have in my later years, because I admit that I'm a recovering Lone Ranger, which is another sort of a conditioning I think that happens in medicine. But I have in the last, I would say maybe the last 10 years since I became a mom, and my son's 11, but like this was about the time that I really started to lean into mom communities, communities that just were like spiritual communities that really could pour into me. And it takes some discernment, but it also takes some intention to create these communities. But
it does.
I will tell you that having found even the medical community, for other physicians, other clinical communities of Black women who we lift each other up, I think that has really helped to keep my stress level low, because there's a shared experience. There's a shared experience there. And I think one of the things that exacerbates stress is isolation, feeling like you're alone, feeling like no one can understand you, feeling misunderstood. And let's be clear, that can happen in one's own community too, right? It can. But when you do the work of finding like, who are those people, even like locally, gardening communities, yoga community, whatever that looks like for you, right? So that's, I think for me, if I were to say like, what is a code for calm? Like community is definitely one of those. It has been for me.
And I love that you said that. And I would like to add on to that, a community of people that you actually touch, that you actually connect with. I'm not talking about your Facebook community solely. You know, I'm talking about, even if it's virtual, people who really talk, connect intentionally, talk and share. There is safety in numbers, right? And having a community, and we're not always our best. One of the challenges in being an entrepreneur is that you can talk to yourself and you answer back. And you believe yourself sometimes when you shouldn't. And
Ooh, speak.
You know,
speak.
Yeah. And so having a community, sometimes we need to have trusted people who have other insights so that we don't go down the wrong road ourselves. You know, I think this is just such a rich conversation, and I hope that is giving the listeners hope. Our leaders, our physicians, and DMPs and PAs, whatever level, the informal leaders, the nurses, hope that they can live well, live healthy, and have a code for calm that can sustain them both in their careers and in their life. And they need life, Dr. Clairborne, after work. Your job should not be your sole definition of who you are.
Speak. That is so true. It's what you do, not who you are.
It's what you do, not who you are. That's right. And you do what you do. Ideally, you work to live. You don't live to work. I mean, that's
that
what
part.
I believe. You know, I don't. There has to be more. So I think we could talk forever, and we must have this conversation again. But Dr. Clairborne, as we begin to close, tell the listeners where they can find you, and then please close with your code challenge for calm this week.
Right. Well, so if you want to learn a bit more about me, the first thing that I would invite you to do is to listen to my podcast. It's called Beliefs, Behaviors, Communication, and the Brain. You can find that wherever you enjoy podcasts. If you want to connect with me, I mostly live on LinkedIn, and you would go to LinkedIn / Dr. Maiysha, DrMAIYSHA. I do happen to be on YouTube, not so much on Instagram. I mean, I'm there, but I'm not on Instagram. So if you email me there, I might miss that. But on all platforms, it's always / Dr. Maiysha. And finally, if I were to leave one code for calm, I would say connect with others.
Connect with others is a code for calm. I love that. Well, I hope that you enjoyed this episode of Code Calm. And remember, if you enjoyed it, to share it with others and know that you can live healthy and live well. Again, thank you, Dr. Clairborne, for being our guest today. And everyone, make it a great day.